Welcome to Elisha Space, a sanctuary for healing, growth, and authentic conversations. If you're new here, I'm Elisha, a counseling expert dedicated to guiding others through life's emotional and mental health challenges. In today's episode, we're uncovering the truths behind two widely misunderstood diagnoses: Histrionic Personality Disorder, HPD, and Obsessive Compulsive Disorder, OCD. Whether you're navigating these challenges yourself, supporting a loved one, or seeking to learn more, this space is for you. Let's dive in together with empathy and understanding. Histrionic Personality Disorder, often abbreviated as HPD, is one of the Cluster B personality disorders, a category that includes emotionally intense and behaviorally dramatic conditions. But what lies underneath HPD is not drama, it's a deep-seated need for connection, validation, and belonging. Here are some key characteristics of HPD. One is emotional overexpression. Individuals with HPD often express intense, shifting emotions that may seem exaggerated to others but feel very real to them. This emotional expressiveness stems from an intrinsic desire to make connections and be understood. Number two, attention seeking. Many individuals with HPD actively seek admiration and approval, often feeling an emotional void when they're not the center of attention. When handled compassionately, these desires can be redirected towards healthier ways to build self-esteem. Number three, suggestibility. Those with HPD may be highly sensitive to external influences, such as cultural trends or opinions of others, and this can shape their behaviors. Number four, focus on appearance to draw attention. For some, physical attractiveness or dramatic gestures are used as a means of gaining validation. Instead of judging these actions, it's important to explore the unmet needs beneath them. As a counselor, my focus is to help individuals with HPD uncover the emotional dynamics driving their behaviors. Counseling for HPD often involves exploring self-esteem challenges, building coping skills, and fostering authentic connections rooted in mutual understanding, not performance. Obsessive Compulsive Disorder, or OCD, may seem markedly different from HPD. While HPD is often outwardly emotional and expressive, OCD is like a war fought silently in the mind, a cycle of intrusive thoughts and repetitive behaviors aimed at quelling anxiety. Obsessions are unwanted, intrusive thoughts, images, or urges that feel impossible to control. That can range from fears of contamination to intrusive doubts about safety or harm. These obsessions create intense anxiety. Compulsions are used to manage the distress caused by obsessions. Individuals often develop compulsions or repeated behaviors or mental rituals. Compulsions may seem irrational, but they are a coping mechanism aimed at restoring a sense of control. Most individuals with OCD recognize that their obsessions and compulsions are excessive. But even with this insight, breaking free from the cycle can be overwhelming without professional support. From lost hours spent repeating rituals to constant avoidance of perceived triggers, OCD can have a profound impact on one's relationships, career, and confidence. The good news? OCD is one of the most treatable mental health challenges with the right interventions. Evidence-based approaches like cognitive behavioral therapy, or CBT, and specifically exposure and response prevention, or ERP, are often transformative in managing OCD. Both HPD and OCD have ripple effects, often reaching into every corner of life, whether it's relationships, work dynamics, or even moments of self-reflection. The emotional intensity and desire for attention may impact friendships and professional relationships, as others sometimes misinterpret these behaviors as manipulative or superficial. This is regarding HPD. However, for OCD, the time-consuming nature of compulsions and the anxiety tied to obsessions, this can lead to isolation. Individuals with OCD often struggle to explain their behaviors to others, fearing misunderstandings. Our goal in counseling and in creating this podcast is to foster understanding. By understanding these challenges, we can replace judgment with empathy. No matter how overwhelming HPD or OCD feel, healing is always possible. And counseling doesn't just address symptoms, it paves the way for growth. Healing involves learning to engage with your emotions, thoughts, and inner self in ways that align with your values and aspirations. Here are some tips for personal growth. For HPD, practice self-validation techniques to build internal confidence. And then find ways to connect authentically with others by listening and fostering mutual understandings. For OCD, explore mindfulness techniques for observing intrusive thoughts without attaching judgment. Use incremental exposure to triggers while delaying compulsive responses, empowering yourself to disrupt OCD cycles. Here at Elisha Space, we believe in the power of shared stories, authentic connections, and mutual growth. This isn't just a podcast, it's a sanctuary for healing, a place where compassion meets understanding. Whether you've lived with HPD or OCD, supported someone through their journey, or simply want to expand your insight, your voice matters. Comment below, share your experiences, and let's build this community together. Thank you for joining me here at Elisha Space. Remember, every step towards understanding, every conversation shared, is a step towards healing. Be kind to yourself and others, and know you're never alone in this journey.